So the procedure is done using an endoscope, which means a camera, long camera with a lens on the end. And most people will be aware of what that is. That's called a gastroscope. So if, for example, if you're a patient coming in to have this procedure done, we will have gone through, had a conversation beforehand, either in person or on the telephone, make sure that you're eligible, make sure that you fulfill the right criteria, make sure that there are no reasons to not do it, contraindications in other words, and there are very few specific contraindications for this procedure. Once we've made a decision to proceed, then we would ask you to start a liquid diet. The reason for that is because in the immediate period after the procedure, you'll be on the liquid diet for probably a couple of weeks, and that means having literally liquid in your diet, so that when you swallow and drink that nutrition, it goes into the stomach, which has been treated, and allows the stomach to settle down. We do that in the 2 weeks beforehand, and then usually in the 2 weeks after the procedure, and then you gradually build up into a semi-solid and then a normal diet. The fact that you're having a procedure, when we do endoscopy in normal situations, we do it as a day case. In this situation, we would keep you in overnight just as a precaution. You would have a full anaesthetic, so you're not having an intravenous drug which is just going to make you sleepy for 10 or 20 minutes. This procedure takes about an hour, hour and a half, so you're under a full anaesthetic. You stay in overnight. You'll have some antibiotics to take or to be given on the day of the procedure and the following day. And then once you've woken up, we move you from the operating area back to the ward. We give you something to drink that evening. We keep you in overnight. We repeat some blood tests the next day, and then you go home. You're under regular monitoring as an outpatient. That can be done physically, face-to-face, or it can be done verbally over the telephone or by Zoom. We get the dietitians to keep an eye on you regularly. They'll do a consultation every 2 to 4 weeks, and gradually over time you'll become more familiar with the changes in diet and lifestyle, to the extent where if you look at the data in terms of what people have lost, for example, the evidence suggests that at 1 year you can lose up to 20% of your total body weight loss, or total body weight I should say. And there are studies that have been done now that go over 5 years, so people that have had the procedure done now or 5 years ago, and you look at where they are now on their journey, and they are able to maintain that weight loss in the region of about 18 to 20%. So that's very exciting because of the technique, because of the less invasive nature of the technique, and it compares very favourably to some of the other more aggressive techniques that have been around for some time.